Welcome to Dental Assisting here at TCTC. My name is Mrs. Woods. I'm a little under the weather with the crutches. I had a little accident last week, so just bear with me. So we're going to start off by showing you all about our lab. When you're in dental for the 2 years, you learn all kinds of skills. So first we're going to start off with our seniors. We have Josie and Alyssa. And they're going to start showing you proper oral hygiene. But first off, let's look at our classroom. So this is where I lecture. These are your desks, and we teach from our big screen TV up there. It's a great learning tool. Definitely well put to use. Okay, so over here we have Alyssa and Josie. And one of the skills, like I said, is proper oral hygiene. So she's going to just touch a little bit on what they've learned.
Okay, so first you start with an ADA approved toothbrush. You brush on a 45-degree angle twice a day. Most important is at bedtime. You brush in circular motions, and then when you floss, you're going to use 18 inches of floss. And you should always floss before you brush your teeth. And you'll also floss against the tooth and not the gum.
Excellent. Okay. Now we're going to move on to X-rays. Your senior year here at TCTC, you're going to learn how to take X-rays. We have indirect imaging, which means they will expose an image on a phosphor plate, and they will take it and put it into this digital scanner, and it'll scan it and bring it up on the screen. So they're going to get ready and take an X-ray here. All right. So you going to take a picture of 8 and 9? Or you want to take a picture of something else?
No, I'm just going to do this.
Okay, so Josie's going to take a picture of teeth number 8 and 9. It's called a periapical. This type of X-ray is only going to get 1 or 2 to 3 teeth, 3 teeth maybe, 2 to 3 at the most. And it takes a picture of all the way around the tooth. So you can see if the tooth has a fracture, how large maybe the abscess is. Clear. Okay, she exposed the image. So now she's going to come over here, and Alyssa's going to scan it and upload it into the patient file. It's always exciting to see the outcome. Oh, that's a very good X-ray. Okay. So on this X-ray, the main thing we're going to be looking for maybe something at the apex. Okay. The patient says they're having some pain, some pressure. So what we're looking at here on this X-ray is something along the apex up here. Then you can see also if this is a real tooth, which it's not, you could see inside the tooth, which is where the pulp is. Okay. And you could see if there was a fracture or crack in the tooth. Okay. And you can also see if it was over here, she's going to take a picture of number 3 now. And that would actually show the sinus. So this is going to take a picture of a posterior tooth, which is tooth number 3. Okay. This is a molar tooth, and it can show how many roots are on there too. She's going to expose the image. Clear. And both of these girls passed their test, and they received their Ohio radiographer's license. So they are now able to work in a dental office and take X-rays. Their senior year, they can be employed in a dental office. Josie already is working. She works for Dr. Sheth and Dr. Nadler. And Alyssa is going to probably be working in January. She has a job lined up also. So there we go. You can see tooth number 3. Okay, you can see there's 2 roots there. And like I said, if there was an abscess, it would be right about here. But this is a periapical of tooth number 3. Okay. All right. Nice job. Nice job. Okay, so we're going to move on to ultrasonic. Your junior year, you learn about cleaning instruments and sterilization. Okay. And Josie's going to show us what we do with instruments after we are done working on a patient.
Okay, so first you have to put these gloves on. And you take your instruments and you just place them there. And you turn it on and it runs. And then you take them out. And you rinse them with water. And you just dump them on there. And then you take the sterilization bag and you place the instruments inside. And then you seal it up. And before it gets sterilized, this little indicator is pink. And then after it's sterilized, it will be brown like this one.
That is called a chemical indicator.
And then you come over here. There's these little trays in here. And then you hit pouches and start.
And that's how we sterilize our instruments, so they're free from microorganisms. Okay, now we have Alyssa. She's going to show us how to take impressions, another skill you learn here in dental assisting.
That's when it's done.
So what these impressions do, they provide us, so we can make a mold. We'll pour stone in there, and it'll be, that's a negative impression, a negative feedback from our teeth. So then we will have a study model, which we could make bleaching trays. The students will make bleaching trays. The students can make mouth guards. You can also have just diagnostic study models from there. You're going to seat it as if the patient was sitting in the chair, posterior to anterior. And then while that sets up, go ahead and show them the final.
This is what it's going to look like at the end.
So those will be poured up immediately into stone, and then you will have the actual stone model of your teeth. Good job. Okay, over here, another skill is chair side assisting. So they're going to go ahead and show you some chair side skills. Okay. So we're very fortunate to have these beautiful operatories. All the technology we have here is some of the latest and greatest in dental. So now we're going to go ahead and show a slideshow now that we got to see our actual lab and some of the skills that goes on. Normally we have in-person open house, which is a little more, you get to see more hands-on. You could actually come in and actually do help with the students do some of the skills. And you good? Okay. So like I said, this is a little different, but obviously 2020 has been very different for everybody. So just bear with us here. How CTE works. TCTC is a nationally recognized career tech center. So, it says share screen, your share screening. Mia, can you see my screen? Okay, so at a career tech, CTE is career tech education. That's what our school is, okay? The graduating class, so 93% of career tech education students graduate from high school compared to 80% of the non-CTE students. Prepare, so 91% of our career tech education students are better prepared for their future career compared to 44% of the non-CTE students. And 90% of CTE students have the ability to learn real world skills compared to 49% of the non-CTE students. So obviously what that's saying is when you're here for 3 hours in lab, you're learning all these hands-on skills. So you're ready. I have about 5 of my seniors right now. They take their academic classes in the morning and then they leave instead of going to lab, they actually go work at a dental office a couple days a week. All right, dental assisting. So what are we going to learn in dental assisting? So we're going to learn how to take impressions, which we saw the girls take impressions. Dental radiology procedures, as you could see, we're all digital. Okay, very high tech here. We use phosphor plates, which the girls scan and put right into the computer. You got to see that. Chairside assisting. You'll learn dental materials, how to mix them, all about them. You'll learn dental procedures like amalgam procedures. You'll learn about composite procedures, which are restorative procedures. Learn sterilization. I also teach medical dental terminology, which is worth 3 college credits if you decide to go on to college after you graduate. Basic dental hygiene, and then you will get your CPR in medical emergencies. All right, so you're accelerating your success. So you're going to receive your dental radiology license. So all of my seniors that took their radiology license test last month passed. So they have an actual license before they even graduate. You're going to get your CPR, like I said, your first aid certification. You're also going to take your Danby test at the end of the year. Okay. And then you are ready. Be ready for TCT. You earn a proficient score on the end of your course science test. You need strong reading, writing, and math skills, a cumulative 2.5 GPA. You must have a C or above in algebra, positive attendance record. I can't stress that enough. It is so important to be in class every day because you can't go home if you miss school and practice your dental assisting skills or your X-rays at home. Okay, I'm going to go ahead and show a little video here.
Dental assistants are valued members of the dental team and play an important role in your office visit. Dental assisting duties are perhaps the most varied out of everyone in the dental office. Dental assistants' tasks can include making impressions of patients' teeth, taking and developing X-rays, assisting the dentist during patient treatment, performing office management tasks, and teaching proper brushing and flossing techniques. Not to mention that dental assistants play a key role in helping to make patients feel comfortable before, during, and after their treatment. Thanks to the high technical and interpersonal skills that dental assistants offer, you are sure to be receiving the highest quality dental care possible. If you're interested in thanks to the high technical and interpersonal site at ada.org. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
All right, let's talk about our career tree here. When you start out, the roots of your tree, you want to grow as a professional. Okay, you're going to start out when you graduate here. You will have your certified dental assistant certification. When you leave, you can work in a pediatric office. So you could be a pediatric assistant. You could work in an orthodontic office if you want to put braces on and take them off. You could work in oral surgery, which they do extractions, They do jaw surgeries, anything that is major surgery of the maxillary mandibular jaw. You could work in an endodontic office, which they do just root canals. You could work in a dental lab. You can make crowns. You can make bridges. You can make dentures. You can make partials. Okay. You could also work up front as a receptionist, or you could work in dental infection control technician. Okay. Let's move on here. So when you graduate, you are ready to, you're prepared to work in a dental office, or you could go straight into YSU, Lakeland College, Tri-C for dental dental hygiene. You could eventually go on and expand your career in EFTA, which is expanded function dental assistant. They place the fillings. The dentist prepares the tooth and then they place the fillings. You could do marketing and sales, okay? You could do supplies in dental. So you have so many options here to go from. And then if you decide to go on and get your bachelor's or your master's, you could be a dentist, you could be an orthodontist. Just think of all the skills and everything you've attained since you were a junior in high school to prepare you better for your professional career. All right, dental assisting by the numbers. So last year, dental assisting maintained 100% retention rate with the 2020 graduating class. And then more than half of the dental assisting 2020 graduates enrolled at a college or university in the field of health or science. And the other half of students that did not go on to college, they were already employed through TCTC. So we were able to help them get a job in the dental assisting field. It's another employment opportunities video.
When you visit the dentist office, the person you may actually spend the most amount of time with is today's featured career, the dental assistant. Abby?
Oh, hey, how's it going?
Brian, nice to meet you.
Welcome.
I'm gonna warn you, I haven't flossed.
That's okay. Come on in.
Okay.
As a dental assistant, we are passing the dentist instruments. We are setting up the treatment rooms for the dentist, so when he comes in, everything is prepared. We are also giving the dentist feedback on what the patient has told us in the room previous to the dentist coming in. We polished his teeth, and we also flossed. Oral hygiene is looking really good.
Okay.
Saying that he's brushing his teeth twice a day. Mom isn't helping him, though, but I think he's doing a pretty sufficient job. As a dental assistant, you are working with the patient's file. After a procedure, you're writing in what was done. You need to be making sure that everything is in order so that nothing is getting mixed up. Being my dad as a dentist, I've always been in this profession. I've always been coming to his office, wondering what he's doing. I think it was age 14 where I started working here for the summer, pulling patient charts for the next day and developing X-rays.
So a big part of your job is using the technology and accessing those images on these computers.
With our digital X-rays, they are taken and transferred into the computer. So one of our jobs is we bring them up for the dentist. So when he comes in the room, he can see the X-rays and he can diagnose any problems. Being an assistant to the dentist, you need really good manual dexterity. You're passing him instruments all the time, not even looking up to see what you're passing him. Have to graduate high school with prerequisites, and then also you would have to go to a college. It's a 10-month program, and at the end of the program, you gain a certificate. And you have to upkeep that with continuing education. This requires you going to lectures or different conference meetings. A typical day in the life of a dental assistant, first things first, you want to make sure that you're prepared for the day. So you're looking over patient charts, looking for medical history. You're also getting the trays ready. We're making sure that instruments are sterilized. We come in every day, it's different, so we need to be prepared for it. We always want to make sure that the patient knows why they're here. And then we sit them down and we go and get the dentist so he can come in and start his work. After we dismiss our last patient, which is around 5 o'clock, we have to come back and clean the operatories and get ready for the next day. I only work 4 days a week from 8 to 5, but most dental assistants work Monday to Friday from 8 to 5.
What are you gonna do? You gonna go snowmobiling, stuff like that?
It isn't snowing.
It isn't snowing.
So this is what I do. I come in, greet the patient. I'm building trust with the patient just like you are doing right now.
Well, I'm doing a pretty good job then, aren't I?
He is,
Do you trust me?
Yeah.
Alright, give me a high five.
Usually when people come in, they're very terrified of the dental office. Most people have really bad experiences. It's very important to be social and compassionate towards the patient. My favorite part about being a dental assistant is working with kids. I really enjoy having kids of all ages come into the dental office and being able to teach them oral hygiene instructions and just like watching them just totally eat that up and how excited they get. Good, hey? Do you like blue?
Yeah, and I also got a red one.
Do you also have a red one? Well, that's good. Okay, so do you want to come out and get a prize with me? Okay, come right this way. If I would want to become a dental hygienist, being a dental assistant first would really help me in that field, going to school and knowing what I knew in dental assisting. If you're wanting to do something more with your life, it's a great stepping stone. If someone came up to me and they weren't sure what they wanted to do, but knew they wanted to stick in the healthcare system and work with people, I would definitely recommend becoming a certified dental assistant.
To summarize, some of the skills you'll need include manual dexterity, clerical ability, motor coordination. You'll also need to be detail-oriented, social. You'll usually require 1 to 2 years of post-secondary education. The average salary can range from $33,000 to $44,000 per year. The future outlook for this job is promising, as employment opportunities will be increasing in the coming years.
Thank you very much for showing me around today.
You're very welcome. Thank you.
Once again, I'm
Okay, so here's some student testimonials. So Garrett was one of my first year students back in 2017. So he said, going to TCTC changed my life. I grew intellectually through the high expectations and encouragement of my teachers and was blessed with many and took advantage of many opportunities. Not only did I receive 2 years of quality education, but I left obtaining 3 very valuable certifications that opened many doors for me after high school. And then Josie, one of my students that is actually here today helping with the virtual orientation, she said the opportunity to partake in such an amazing program at a fantastic school is nothing less than a rewarding experience. My teacher made this program very much enjoyable, and she always kept us on our toes. The chances we were given to be all in and learning hands-on was great. Okay, so you want to apply if you choose dental by Friday, January 15th. And thank you for joining our dental assisting virtual orientation. Does anybody have any questions? I'm going to bring Josie and Alyssa over here. So I'm going to have them talk, give their experience, and tell them what do you like most about dental?
I think I like most about learning something that most high school kids wouldn't be learning, because it makes me feel like a grown person, like big girl things, So I think that's probably why I like the most, because like most 18-year-olds aren't doing this; they're just doing normal school. So.
And Josie, you started a dental assisting job when?
In October.
So she's a senior, and a job came up. So the Dr. Chef hired her, and so she works a couple days a week. Actually, works 3 or 4 days a week.
5 days.
Oh, she works 5 days. So she goes to school in the morning, and she's able, if we were in regular session school, not COVID school, she would take her academics in the morning, and then she would leave at 11 o'clock a couple days a week and go work at Dr. Chef's office. And then the other 2 days she would have to stay in lab. So she's able to work while in high school. Okay, Alyssa.
Coming to TCTC is so much better than like just your normal school, and like it sucks to like leave your friends and stuff, but when you're here, like you know so much more than like what your friends are learning at school. And the teachers here are all wonderful and really like make sure you know exactly what they're talking about, and they're all very nice. And Mrs. Woods is the best. She makes us good pictures, and we all know exactly what she's talking about.
I'm not good at taking pictures. It's a joke.
But if you're interested in dental, you should definitely come, because you learn so much here, and then you'll be way more advanced. Even if you want to go to college, you'll already have college credits and be advanced than people who are just coming out of high school. And
Okay, awesome. So Alyssa's already applied for hygiene school, and that's her goals after college. And Josie wants to be a full-time dental assistant, so she already has her job. So when she graduates, she gets to be a full-time dental assistant. Okay, thank you everybody for joining. Any questions before we end?